All right, guys, thank you for coming on. I appreciate it. I really enjoy teaching and instructing about RTM, remote therapeutic monitoring. So, thank you guys for giving me your time. I want to make it well spent here this afternoon, evening, wherever you're tuning in from. So, I got a little structure for today. So we'll get into this is meant to be really an overview of RTM. So we'll get into the codes, and then I want to share just how it can make sense as far as profit for you and also just for your patients. So that the goal is really that at the end of this presentation, that you have a clearer sense is if RTM is worthwhile for you to get implemented into your practice. So a little bit about myself. So I'm a physical therapist, John Mark Chesney. I live in Knoxville, Tennessee. I own and operate a clinic. So we're a hybrid clinic. 50% of our patients are Medicare, and the other 50% we're out of network type of clinic. So two other PTs that work for me. So one location clinic. We started in 2017. This is my family, so I'm grateful for them. I just did a little family devotion reading, and then hopped on over here back to the office to do this webinar. So thanks to my family for letting me jump on here late and check out a little bit early for bedtime stuff. All right, well, just a few important notes. I am not an attorney. I am not a legal expert. There's rules and regulations concerning RTM that will likely change in due time. So, at some point, if you're watching a recording of this, there very well may be some information that is outdated. This webinar is not intended to and does not serve as legal advice or as consultative services, but is for general information purposes only. It's really recommended that you consult with a legal expert as needed for your own due diligence. So why this webinar? So I kind of mentioned before a little bit about myself and the goal of the webinar. But I'm a physical therapist. Most of you are either PTs, OTs. Maybe we got some speech therapists on here. But being in business is hard work, especially if you have your own practice. And RTM has allowed us to grow revenue and profit without having to get more leads, without having to spend more in marketing, really without even having to see more patients, without having to invest in expensive equipment or programs, or to recruit and hire more staff. So that's a huge benefit of RTM. Is most of you already have everything that you need besides a few key things, but you don't have to go into this huge extensive process of making your clinic more than what it really is. You're likely already doing 90% of the work of RTM. You just need to figure out the other 10% so that you can actually bill for it. Medicare, has made cuts past 2 years. There's been proposed cuts for 2023. For 2022, the year they're in, they actually passed legislation that was pro-therapy in regards to RTM, remote therapeutic monitoring. But as a profession, I just have not seen many people talking about it. I've through this, webinars, past webinars, and just posts, I've been trying to help spread the word, but I see very little of people that are actually up to date with knowing what it is and how it can aid you, your patients, and your practice. So that's something that I hope to accomplish here through the webinar, is to just add to the body of knowledge so that you guys are better equipped and know about RTM. So a few of the things, I want practices to be successful, and RTM, I really see it as a way that can add value and add to your success as a practice. I've personally watched and paid for RTM trainings. This is back earlier in the year when I was starting to get interested really for my own purpose of here in the clinic. And so I was consuming all the information that I could find out there, reading documents, consulted with industry experts to figure out what I needed to know to implement RTM into our practice. If I had implemented sooner, so we were, relatively early adopter of RTM, but if we had started at the very beginning of the year, I calculated about another 7 to 8 grand that we could have capitalized on. I'm happy that we're now receiving reimbursement since we've been utilizing it here since late spring. But there's been revenue missed out on because we didn't even implement it sooner. And the other thing is you can figure this out. I figured this out, without much help besides, just consuming all the information, really devoting my time to understanding it and getting to a point that I really felt confident that I knew what I was doing and that I was meeting all the rules and regulations. And you can do the same for yourself. And then at the conclusion of the webinar, so I've put together a course. It's called the Remote Therapeutic Monitoring course. So if RTM is something that you're really interested in, then I invite you to stay on for the final 5 to 10 minutes of this webinar, where I'll talk more about the course. But ultimately, as busy business owners, this is what it's really designed for. People who just don't have the time to figure it out, the missing 10%, and you want to get it implemented as soon as possible, but to make it as easy as possible as well. RTM can be confusing. When I was going through the information, I just had to keep going back, and some of the presentations I watched, I got more information, but at the end of the presentations, I would oftentimes be a little bit more confused just because there are some confusing pieces about it. So what I wanted to do is, if there had been a course that had been created, I likely would have been a consumer of it and purchased it. But instead, there wasn't one, so I decided to create one to help others get implemented. So what is remote therapeutic monitoring? So ultimately, our team was developed out of this period of COVID, right? Healthcare shifted where there was a need to deliver remote or telemedicine, telehealth, remote care, healthcare. So RTM has ultimately been developed out of a need to continue developing services for the general public to aid in their healthcare. And so that's what RTM, really why it was developed, to allow that continue to happen. It is different from telehealth. Telehealth, if you're delivering telehealth services, therapeutic telehealth services, you're providing treatment, right, over some video type of apparatus, but you're providing treatment in telemedicine, telehealth. And you're delivering care. So RTM is not a delivery of physical therapy or occupational therapy over a video conference. Ultimately, for our purposes as therapists, RTM is meant to for you to monitor your patient's adherence to their exercise and monitor, to develop it, to answer questions, to track their adherence. Is ultimately what we can provide as a profession, and now get reimbursed for that time that we are doing that for our clients. Is the difference between RTM and telehealth. So there are 5 codes, and these are new CPT codes as of 2022 that are all specific towards RTM. So we're going to go over these codes. This is just a summary page, and then the next few slides we'll get into more detail about the codes. But the first code is 98975. It's your initial setup and education. This is a one-time per episode of care code. And these, I have the dollar amount, and again, this will vary a little bit based off of the region you're in and just the reimbursement rates. But this will give you an idea of around what that is. So that's a $20 charge for the initial setup and education. 98976 and 98977 are ultimately the same code, except for a respiratory therapist, you would use 98976. If you're not a respiratory therapist, then 98977. So most of us on here, again, PTs, OT speech, would use 98977. But this is the code that you can bill for the device supply for 30 days. So how I think about this is you can get reimbursed for you giving your patients the software for 30 days. And that is reimbursed at $55 per 30-day period of that rental of your software device giving your patients. And then the final two codes are 98980 and 98981. So these are the two time-based codes that you're actually monitoring your patients. So the first one, 98980, is for the first 20 minutes within a calendar month for right around $50. And if you were to go above and beyond that 20 minutes and accumulate a second set of 20 minutes, so from minute 21 to 40, if you reach that 40-minute mark in a calendar month, you would bill 98981. And you can bill 98981 multiple times. There's no limit for 98981 per calendar month, and that's reimbursed at $40. So getting into some more specifics. So there are requirements, certain metrics and rules that you have to hit to make sure that you have satisfied the coding requirements. So 98975 reads remote therapeutic monitoring of the respiratory system, musculoskeletal system, status, therapy adherence, and therapy response. This is, again, the initial setup and patient education on use of the equipment. How to use the code 98975, report this code only once per episode of care and only if monitoring occurs over a period of at least 16 days. Use this code to report the initial time spent setting up and teaching the patient or caregiver how to use the device. All right, so the next two, again, these are the same. 98977 is the CPT code that if you're a non-respiratory therapist, then you would use 98977. But in essence, the codes read the same as far as the requirements. This is for remote therapeutic monitoring of the respiratory system, musculoskeletal system, therapy adherence, therapy response, the device supply with scheduled recordings and or programmed alert transmission to monitor musculoskeletal system each 30 days. Again, think about this as you're just supplying the device for 30 days. How to use the CPT codes 98977, report this code only when monitoring the musculoskeletal system and only if monitoring occurs over a period of 16 days. All right, and then we have our final two time-based codes. So 98980 is for the first 20 minutes of monitoring the management services. So this could be a physician or other qualified healthcare professionals. Time in a calendar month requiring at least one interactive communication with the patient caregiver during the calendar month for the first 20 minutes. So you would use this, you'd report this code after accumulating 20 minutes of time spent reviewing, integrating the data collected during remote monitoring to inform treatment goals, monitoring the patient's progress and adherence to the treatment plan, and providing clinical feedback to the patient and the caregiver. And then 98981 is pretty much the same as 80, except this is for your second set of 20 minutes within that calendar month. All right, so would like to talk about is how to determine if RTM is worth your time. And that's probably the most frequent question that I get asked is understanding if it is worth your time to understand it and get it implemented to your practice. So ultimately, I can't answer that question for you because I don't know how much your time is worth. So if you're Elon Musk, it probably is not worth your time. But most of us on here, I would reckon that our time is not as valuable as Elon Musk. And so I really do see, I would anticipate this being worth your time. But again, that's for you to decide. And what I like to do here is just explain how you can bill for it so that you can decide. But for instance, last month we added about a little over 1,600 in extra revenue. This is from 18 patients that we had enrolled for the month of August. Again, we're a small clinic. So, we have 2 other PTs and myself. I'm primarily out of patient care, but that was just with 18 patients enrolled. One of my students from the first cohort of the RTM course, in his first month, he billed $3,000. And I do know about his practice too. It's very similar to mine. He actually only has one other PT and himself. So it's also a small clinic, but he was able to bill a significant amount, $3,000 in his very first month implementing RTM. And it's very reasonable to expect close to around $165 of RTM revenue per Medicare patient. So that would be if you're billing out for each patient, each one of the codes. So if you've satisfied the time for the first 20-minute charge plus the second 20-minute charge, you would be right around $165 of revenue per Medicare patient. So again, is RTM worth your time? So I want to explain it from a few different points. The time-based codes, 98980 and 81, so just the 2 time-based codes, they're currently reimbursed at a rate very similar to Medicare therapy sessions. So if you're already accepting Medicare and the rates are something that you can function with, then RTM is comparable, very comparable. For example, if you accumulated 20 minutes with 3 different clients, just the 20-minute codes, right? We're not talking about the other CPT codes, but just the time-based, that would be 98980. If you can accumulated that for 3 different clients of 20 minutes, so that's an hour of time, you would receive approximately $150 for that time. So this is where you can do more of the math. And I think I put a post out there about $375 per hour. And so I want to explain how I got that figure where it makes sense. So if you had, again, 3 patients enrolled in RTM, so we already talked about how you could get, you can accumulate 20 minutes of RTM. So if we think about this per patient, so for each patient, if you accumulate 20 minutes of RTM minutes, $50, you bill the initial setup for the device, that's another 20. And if you bill for the 30-day device supply, it's $55. So for that one patient, you've billed out right around $125 for 20-ish minutes of time. So if you have 3 patients, 125 times 3 is $375 for probably a little over 1 hour of your time. So the other considerations, in this figure is just the time for any administrative time and or fees for the RTM software. But if we're talking about around $375 an hour, I would anticipate you got some room to spare, if you will, of some extra admin time or paying out some other kind of fees elsewhere. But this is where it really gets fun. Understanding the 20 minutes that you've accumulated for each of your patients, this can take place within a regular patient visit, right? So it's not that, let's say you have a full day, an 8-hour day. It's not that you have to spend another extra hour accumulating RTM minutes. You can accumulate this within your regular day. So for example, let's say that you treat on the hour, you got 60-minute appointments. Let's say you spend 57 minutes for your regular CPT code. So you only technically need 53 minutes to bill out 4 units for your Medicare patients. But let's say you had 3 minutes left over that you could devote to RTM minutes. Over the course of the month, let's say you got seven visits for this patient over the course of the month, and you averaged around 3 minutes RTM minutes with each visit, you would achieve over that 20 plus minutes of RTM minutes without requiring any extra time. So the $375 an hour is really not fair description, because the hour needed to fulfill the RTM time is already factored into your day. So what you should consider is, for the 375, how much extra administrative time do you need to deliver RTM? And so that's going to be based on a few factors. If you're solo practice, then you're doing it by yourself. If you have some support, staff, then they can do it for you. But again, we're talking about a nice sum of money that you could afford to have some extra admin time to be able to collect on. All right, so getting paid for the time and service you are already providing. So this is, again, most of the stuff you guys are already doing it, right? Are you already spending time creating your home exercise programs? Yes, you are. Are you already spending time updating the home exercise programs? Yes, you are. Do patients call asking to speak to you about their programs or about their exercises? Yes, they do. What happens when this takes place, when the patient is not there with you? You're not able to bill out this time, or you haven't been able to bill out this time, but now you can. The patient does not have to be there in the room with you to bill out this time when you are categorizing your RTM. But what happens when your patient is in quarantine or on vacation out of town, or they have to cancel late, leaving a gap in your schedule? I don't know about you, but we haven't done a great job of implementing telemedicine or telehealth, but to just get somebody on the phone to chat with them has been pretty easy. And that is all time that we can collect now under RTM minutes. So now you can bill for that time that you interact and remotely monitor your patient's exercise program that you're probably already doing, just not collecting or billing for. So we've been talking mainly from the perspective of yourself as a practitioner, as a practice owner, and billing, but there's also great value for your patients. It's been estimated that roughly only 30% of patients complete their plan of care. This is when I saw this stat, I was shocked, but it is extremely low, right? So that's part of why Medicare has started paying for the service, because they see these numbers of such a low plan of care, and they anticipate that having something like RTM is going to only help improve adherence and compliance with home programs. Patients with poor outcomes lead to unnecessary medical care, surgery, loss of quality health years. Again, this adds to the overall burden of the healthcare system. On the flip side of it, when we have patients that are adherent, are compliant, are doing their exercises, staying engaged, it's going to help with outcomes. It's going to produce engaged patients, improved patient retention, and also when you have happy and engaged patients, it's only of value to you and your practice in improving even word of mouth referrals, things like that. All right, so investment needed to get started. One thing that you do need is you need to have a software program, FDA approved software program, and I put approved in parentheses because it just needs to meet the definitions applied by the FDA for a medical device. This is probably the next question that people ask me a lot, is like, hey, does this work? Does this qualify? Very basic, at least self-test, is if you can't monitor somebody's adherence of their exercises, it's not gonna satisfy the requirement to monitor them remotely, right? It needs to have the ability to monitor compliance of a home program. So that's the very basic level of what it needs to be able to do. But if in doubt, then I would reach out to whoever provides their customer service to make sure that it does meet the full standard. The second thing that you need, besides the software, is you need to know how to do it and need to have an education understanding. You need to do your due diligence to thoroughly understand and stay current with RTM. So questions such as what criteria needs to be met to satisfy each code, documentation standards, billing time, the billing time frame, is different for each code, so it can get confusing. You need to have internal systems to train your team, your therapist, your support staff, whether it be time tracking systems, communication logs. And you really need to think about how to educate your patients to get them on board so that they participate at the level that allows you to bill for it. So who can provide RTM services? So medical professionals, physical therapists, occupational therapists, and speech. So again, I would anticipate that's who we have on here. All qualify. PTAs and CODAs can also provide RTM. However, the time-based codes are subject to the de minimis reduction. Administrative staff, support staff are not allowed to provide RTM services. All right, guys, we're gonna wrap up here with a patient case scenario. And this will be the main kind of last thing here. And then to help to see if we can put some of this information together for you guys. So the patient case example, so you have a patient evaluated on March 26, 2022, left knee pain. The PT provides SAMD is software as a medical device. So they provide the software as a medical device to monitor compliance with performance of the home exercise program and knee pain. PT instructs the patient how to use the medical device, how to capture the data, how to input the data, and to answer all the patient's questions. It required about 6 minutes for setup. So the eval day was on the 26th. Again, this was the setup for the minutes, education, the patient, setting up the software, uploading exercise for the patient, answering questions. 2 days later, on the 28th, the PT logs into the RTM software, spends 5 minutes reviewing and monitoring the patient's program. On April 5th, the PT spends an additional 4 minutes reviewing compliance, asking questions about RTM and adjusting the home exercise program. On the 8th, the PT reviews the patient's RTM and sees that the patient noted one of their exercises painful and unable to complete. The PT decides to call the patient and spends 7 minutes determining what was wrong and adjusting the program. So again, now this phone call is billable under RTM time. On the 12th, the PT spends 5 minutes reviewing the home exercise program with the patient and adjusting the program. The 14th, the PT checks the program remotely, sees there's no exercise completion from the patient. PT messages the patient through the software to check in, encourage the patient to complete their home exercise program, taking 9 minutes. On the 18th, the PT spends 5 minutes reviewing the home exercise program compliance with the patient and adjusting the program accordingly. On the 20th, the patient had an exposure to COVID and cancels the appointment the day of despite not exhibiting any symptoms. The PT calls the patient to review the home exercise program, is able to advance 2 exercises, taking 4 minutes. All right, on the 23rd, the PT reviews the home exercise program during the session for an additional 7 minutes. On the 28th, the PT remotely checks in on the program. All the exercises are complete and as prescribed. This took 5 minutes. And then on the 5th, we have discharge day, the finalized home exercise program for discharge and answer all the questions for 9 minutes. So this is the rest of the information that we need for the 2 time periods. So from March 26th through April 26th, data is recorded and monitored by the PT for a total of 20 days. And then from April 27th through the end of the plan of care, May 5th, data is recorded and monitored by the PT for a total of 9 days. Again, the patient is discharged on the 5th. So this is what you need to be able to answer to be confident with this case. And this is a rather simple case that we're going over here today. But what CPT codes can you bill, and when can you bill them, and how much total reimbursement? So if you're watching the recording, feel free to pause and you can go back to the slides just to get the information so that we are staying on time. We're going to go ahead. And this is the summary page of the minutes, so you don't have to pull out your calculator with all those. But at March, we had 5 minutes plus the 6 minute setup time. April, we had 46 minutes. In May, we had 9 minutes. So these are our answers. So for this case, we can charge $989.75 on or after the April 11th, which is $20. We can charge $989.77 on or after the 26th for $55. And then 98980 for the month of April, we can charge $50, and 98981 for the month of April, we can charge $40. So the total build out for this case is, actually that math is wrong. So you're well over, I think you're at the 165 range here. Yep, 165, should be 165 for this. So you got all the, you really got all the main codes with this case. All right, guys. So I'm going to go ahead. I know I got some questions. Let me just look real quick. This is meant to be an overview. So let me just see here. If there's some kind of more basic, there's real specific questions. Just the intent of this webinar is not to get like too granular. So let me see if there's some more basic ones that could be helpful. So someone asks, is RTM, how is it RTM if you are there with the patient? So one of the codes, again, requires you to have an interactive communication for the time-based codes. And so you can bill your time when you're with the patient. So it doesn't have to be all done remotely. The time that you're devoting to the exercise program is all under RTM. It can be remote without the patient in the presence with you, but it doesn't have to. All right. So like I said, I'm looking for just more general questions. I answered about the software as a medical device, SAMD, and it is for billed under Part B Medicare. All right. And I have some questions about the different software. You know, it's best to, I try not to get into much specifics about saying which are better than the others, because there's so many software out there that they all have different perks and pros and cons and it really is going to align with what type of clinic that you have in that way. All right. So let me go here. 1 second. So that is the end of the webinar. Like I said, guys, I want to keep us on about 45 minutes total. The first 35 for the information about RTM. And so if you are interested, I want to talk a little bit about the course here that we have. So I developed this course. I've taken 2 cohorts already through. I think we have close to 30 graduates. So this will be the cohort number 3 that we are actually starting a week from tomorrow. So next Tuesday will be the start of the next cohort. And this will likely be the last cohort I do this year, just through the season of the holiday. Just our schedules get real crazy. So this will likely be the last one for the year. But about the course, it's $229. It's lifetime access. You can use it for all your staff. You can, if you have staff that come on later, you can feel free to give them the recordings. But it's to help you easily increase your profit without having to see more patients, visit more on marketing like we discussed, and really meant to help you to get this implemented ASAP, and to make it as easy as possible for you is why I developed it. Again, I would have taken this course if I had the chance to, but there was nothing around. So I decided just to make it, since I've already gone through the hard work of figuring it out on my own. So each session will be taught live. You have a lifetime access to all the replays, and also include templates, documents, marketing flyers we've developed, everything that you really need to get RTM going, example documentation notes, exercise flow sheets, patient tracking forms. You can buy one pass, train the whole team, and live email support. So like I said, the next course cohort is starting next Tuesday, September 27th. They'll be taking place each class. There's 4 classes at 8:30 p.m. So same time as tonight. Eastern Standard Time. Here's an overview of the course. So lesson 1, we'll dive deep into coding and reimbursement, an overview of RTM with codes described, explained thoroughly, and how you can maximize your reimbursement, the perfect Medicare visit for RTM. Lesson number 2 is enrolling your patients and the documentation standards needed to make sure that you have everything in case you are ever audited. So how to develop your system for documentation and billing, and also how to communicate to your patients and to your staff to help train them and get them excited about using RTM as well. Lesson number 3 is all about software. So we devote a full lesson to talking about software. So I developed a checklist of the different parts of the software that you should at least know is available, so that you can determine what features you need through this checklist to find the best software available for you. And then we dive deep into case studies. Like I said, today we went over a very basic one, but we go into in-depth walkthrough through case examples that we can talk through just live as you're on the class. And then lesson number 4 is talking about changes, at least proposed changes for 2023. And then we get into more complicated case studies to make sure that you have a complete understanding of RTM so that you are confident to get it implemented to your practice. Lessons learned. So I share all the lessons that I've learned the hard way so that you don't have to learn them on your own. These are the dates of the classes. So next week we'll have 2 on Tuesday and Thursday, and then the following 2 weeks each Tuesday. So we'll finish on October 11th. So I'll put this link in the chat bar. You guys can check it out. I'll email it out to you with you guys. We're just about done here, guys. And then I'll see if there's any other questions I can answer. All right. All right. So yes, this will be cohort number 3. Currently have 27. I think I said close to 30. So 27 graduates from the combination of the 2 cohorts. Like I said, likely the last class of the year. Oh yeah, and I'm also including some bonuses as well. So a Balance and Falls marketing kit. So I have we've had a lot of success marketing Balance and Falls, especially to our Medicare population. So I'm including a workshop I put together, an ebook resource that you can swipe, as well as a newspaper article series, and actually have a second newspaper article series I'm including. It's a question and answer that I've been getting a lot of good feedback and good leads from that as well, that I'm just including as a bonus, if you will, for this cohort number 3. All right, guys, I think it's about it. So the course, again, is for people who want to fast track getting RTM implemented. If you'd like to start billing for RTM ASAP, if you'd rather not piece it all together on your own and you want some help with that, that's why I designed the course, to get concrete confidence and understanding the nuances of RTM, and to be able to work through it together with a group as well, and again, learn from my mistakes. So the first class, again, is next Tuesday. Registration's open. I invite you guys to, if that meets a need, then I'm happy to have you on board. Let me see here if there's any other questions here. If we sign up for the course, is okay. Yeah, you don't have to be live, so I'll send out the recording to all the sessions. It's always extra valuable if you're able to come on live, because you can have your questions answered. But if you can't, then you can watch the recording and email me any questions that you have. So multiple practitioners seeing clients. So yeah, it's just an accumulation of time, Dana. All right, so I think that's all the really main questions here, guys. So thanks again for tuning in. And yeah, I encourage you, if this has been helpful, that feel free to share this recording. I'll send out the recording of this webinar to you likely tomorrow. So if you know anybody else that this would be valuable, feel free to share the recording as well. Thanks again. Good luck to you guys, and let me know if you need any help or if you have any other questions. Thanks.